Hi, I'm Dr. Amanda Ward. I'm here at Bloom Natural Health in Encinitas, and this is Stephanie Gachet, my patient care coordinator. And today on Bloom Healthy TV, we're going to talk about depression. This is unfortunately all too common of a topic, and we have a lot of patients who come in and see us for that reason.
Do you?
I mean,
very common.
Daily, right?
Unfortunately, yeah.
We're seeing it daily, you know.
Definitely.
So as always, as naturopathic doctors, we always want to get to the root cause of this. And the thing with depression is that there's so many different root causes.
Yeah.
You know, I mean, I personally think that society in general in this country makes it all too easy to be depressed. You know,
Yeah, and to not talk about it.
To not talk about it.
Understand root cause or where it's coming from.
Yeah.
You know, people think there's something wrong with them. They have a hard time figuring it out. Like, they can never really put their finger on where it's coming from.
Yeah.
But that's where you come in.
Yeah, and so many of them even say, well, my mom was depressed, my dad was depressed. So I just think, again, society, we're just taught that it's, you know, something you don't really need to talk about, you know, something you don't need to address, and it's common, so we assume that it's okay, that it's normal. And it's not. You know, I always define health as the ability to feel and experience joy every day, you know? I mean, we should.
Feeling good.
If everything's operating right, you know, and all of our chemistries align, we should be able to feel pretty darn happy most of the time.
So the chemistry, yeah, that's kind of what it comes down to, isn't
Yeah,
it?
it does. And we're such, I always say this, we are such complex chemical beings, you know, and really, even women a little bit more so than men, but all of us, you know, we have things like hormones, we have
Yes, we do.
a lot of them. We have neurotransmitters, we have blood sugar, organs, you know, so we have all these little parts and pieces that contribute to this chemistry, and it's either going to be balanced or not. I mean,
I think most people don't know that. Like, I don't think I even, you know, ever fully understood that before
yeah.
Working with you and kind of.
Yeah, well, you see it on
Seeing
paper
all
every day,
these
right? All
angles.
these labs that we test. This is why we kind of joke. We test every secretion that you make, so we can look at all of these things.
We can look at it.
Yeah, and honestly, I think the majority of the time, if a patient's depressed, we see imbalances in all those things: hormones, micronutrients, and even in the organs themselves. You know, and on top of that, we're all toxic, and we know that toxicity tends to, you know, deplete the brain's ability to regulate the neurotransmitters.
Right.
So
it's all connected.
it's all connected.
Totally.
Exactly.
But
so
there's something we can do about it. Which
thank
is encouraging.
God. That's the
It's
encouraging
like
part.
You don't have to sit there and suffer forever with those things.
Yeah, which I think we see a lot of relief in
Yes.
patients' faces when they say,
It's
wow.
the change is the beauty of it.
It's the
seeing
beauty. It is.
Before and after.
Yeah.
You can do something about it.
Yeah. And that's when those aha moments come, right? We get to see, even at the first visit, when we've done all those things, we've tested all those things, and they get to see, wow, this explains a lot, aha, you know?
Right.
And then it motivates them to make all those changes that we're asking them to make. And then, I mean, you see them too in their follow-up visit where they see all these things are corrected.
Yeah.
And how are they usually saying
And
they're
they're
feeling?
feeling good.
They're feeling good. So.
And that's the idea.
Yeah, but you know, depression is a serious thing. You know, it does involve a lot, and please, people, don't be afraid to, you know, to ask for help. You know, and here at Bloom, again, we're going to be sitting down, we're going to be chatting about all these different root causes, and then we're going to be evaluating and testing all them, and then addressing them all. So please just know that there is a lot that can be done. There's a lot that can be done naturopathically. So we really encourage and invite you all, come into Bloom. Give Steph a call.
I'll get you in with Dr. Ward, and
Yep.
we'll get to the root cause.
Yep.